Oakwood Healthcare has been in the structural heart business for many, many years with the types of cases that we perform in our variety of specialties. The new onset of technology, specifically transcatheter technology for valve replacement, is one that Oakwood got into well over 1.5, 2 years ago.
TAVR, which stands for Trans-Aortic Valve Replacement, is a procedure where the valve itself is being repaired and actually replaced by an artificial valve, which is inserted through the femoral artery in the groin and goes all the way up to the aorta, and it's placed under X-ray or echocardiographic monitoring without opening the chest, without doing open heart surgery. Surgical aortic valve replacement is still the number one way of management of aortic valve stenosis. So the only reason why we're adopting this transcatheter valve replacement is for only those sick patients who are not eligible for surgical valve replacement.
They usually suffer from chronic symptoms of heart failure. So they have severe shortness of breath or fatigue or swelling in their lower extremities, which decreases their quality of life or their ability to perform activities of daily living.
This is their chance for life. This is their chance to see literally this Christmas, December of 2013. That's what Oakwood is bringing for these patients and their families.
Dr. DeBeer and DeBoos performed the valve replacement procedure, and so how did it go for you as a patient, and how was your recovery with that procedure?
Well, the treatment at the hospital was great, and the teams headed by Dr. DeBoos and Dr. DeBeer should be highly commended for their work. After 3 days, I was back home and basically very few restrictions.
Wow, that's great.
This is a 20-plus person team in the OR. There is no safer environment.
These patients do not have to have their sternum sawed open or their heart cut into to excise the native valve. So that alone, their postoperative length of stay is decreased. They have a reduction of respiratory issues. They're not ventilator dependent like our traditional open heart patients are, and significantly less pain postoperatively.
Never in my wildest dreams did I ever imagine that we will be coming to a point where we can replace the aortic valve, okay, without opening the patient's chest. So this is obviously a major achievement, the change in the paradigm of practicing interventional cardiology.